Members, Chairman Hernandez is. Oh, Elaine? Oh, yep.
Okay. She just arrived.
Okay.
There you go.
Okay, we're on item number 13, SB 840, Evans Health Facilities Carbon Monoxide Detectors. Senator, good afternoon. Welcome.
Thank you, Mr. Chair. I'm very pleased to present this bill that will help ensure the safety of people living in residential care facilities to make sure that they have the appropriate carbon monoxide poisoning monitoring. Many of us in our homes are starting to install these devices. They're as critical as smoke detector devices. Carbon monoxide can't be detected by your nose or any other method, and yet it is something that can kill people. In fact, 30 to 40 people die each year in the state of California from carbon monoxide poisoning. So this bill would simply require long-term care facilities to install them. I am happy to take the committee amendments. I think they make them a much more practical and stronger bill, and I request an aye vote.
Okay, is there anyone in support of the measure?
Dr. Hernandez, members of the committee, I'm Kathy Barankin here on behalf of the California Coalition for Children's Safety and Health. We were actually one of the co-sponsors of Senator Alan Lowenthal's SB 183 last session, and we actually didn't contemplate that these folks would be exempted from the bill because we know that it's a significant problem, and it is our hope that all dwellings, including skilled nursing facilities, will have this protection. Thank you.
Next.
Mr. Chair, members, Robert Harris on behalf of Service Employees International Union and on behalf of our workers in nursing homes and the people they take care of. We're grateful that the Senator brought this bill forward, and we're grateful for the committee amendments that do make it more practical, and we're proud to support it. Thank you.
Thank you. Anyone else in support? Before we move on to the opposition, let me just go ahead and make sure that we clarify the amendments. I know you're willing to take them, Senator. That's the criteria standards with regard to a recommended amendment would be required OSHPD in consultation with the state fire marshals establish the criteria standards. The CO device, a recommended amendment would be to allow a battery-operated CO device to be installed in order to meet the requirements in this bill. Facility exemption, a recommended amendment would be to require a CO device to be installed in or around the areas that have a fossil fuel burning appliance to ensure the safety of patients and staff. Other health facilities, which was mentioned earlier, the recommended amendment would be to include other health facilities. Timeline, a recommended amendment would be to require SNFs to install a CO device 180 days after the regulations are in effect. And is that correct?
That's correct.
Okay. All right. Anyone in opposition, please state your name and your position. Thank you.
Chairman and members, Barbara Glazer with the California Hospital Association. We are not in opposition any longer with the amendments that the Senator is taking today. We remove our opposition. I did want to mention that 120 of our hospitals do operate hospital-based skilled nursing facilities, and that's why we were in opposition to the bill. We appreciate the work of the author and committee staff on the bill. Thank you.
Thank you. Next.
Mr. Chair, members, Dave Helmsen on behalf of the California Association of Health Facilities, and we too appreciate the author's intent here, and we haven't seen any problems with CO in nursing facilities to date. Thankfully, we segregate the equipment that produces these things from our patients, and we have 24-hour care, so although there have been CO problems in other settings, we haven't had any in our long-term care facilities. We believe the amendments move in the right direction and do make the bill more workable. Unfortunately, in our discussions with OSHPD, we were unable to get any indication as to what the requirements might look like here and how those might affect facility costs. It's a good idea, but at a time when we're reducing Medi-Cal rates for these facilities, it's hard for us to get behind a mandate that would increase our costs and unfortunately divert resources away from employee staffing, wages, and other direct caregiving essentials that we need to be mindful of in this frugal time frame. So we must unfortunately continue to oppose the bill as it is. Thank you.
Thank you. Next.
Chairman, Senators. Steve McLean, Director of Legislation for CAL FIRE. We're not in here in opposition, just want to make that clear. We do not have a position or an approved position with the administration, but we do recognize the importance of the public safety factor in this. The State Fire Marshal's Office does approve and certify these devices, and that's part of our process and part of the reason we're here. In case you had any extra questions, with me I have Deputy State Fire Marshal Vicky Sakamoto. I know she's not here counting heads during 8-10 testimony. She was looking around a little bit, but everything looked okay. But if you have any questions along our certification program.
No violations in this room, hopefully.
Right.
Okay. Anyone else like to present in opposition or any comments? I believe Senator Strickland had a question and or a comment.
Mr. Helmsen, Dave, can I have a couple questions? Sorry to bring you back up here. I just want to understand your testimony today. Mr. Helmsen, so you're saying that you haven't seen any problems whatsoever when it comes to this issue within your facilities?
I'm unaware of any incident whatsoever in California.
Okay, and with the additional amendments, and you mentioned cost, what would a typical cost be for a facility if this bill became law?
Well, and that's part of why we remain opposed. We can't get an indication from the Office of Statewide Health Planning what those requirements might look like. Developed jointly with the State Fire Marshal, we're not sure. If you look at what we do with fire alarms, which are somewhat similar, although I think this would be a less onerous requirement, but they're hardwired in the facility and they have to be outside of every room. I think the language taken in the amendments restricts the location somewhat, at least gives guidance to the regulatory agencies that it's a much narrower approach here, and I think that's all good. But, I guess based on our past experience with OSHPD, they have no trouble making the renovations quite costly.
Do we have a ballpark? I mean, there's no ballpark. I mean, are we?
Well, and that's therein is our problem. I mean, if they allow us to go to Home Depot and put up a simple detector, which I think some of the language alludes to that being okay. But once again, when we talk to OSHPD, they're responsible for implementing the life safety requirements. And if it's a requirement, they'll implement it in the way that they see fit. And unfortunately, we just don't know what that is. So that could go to a very expensive process where you've got to do rewiring. There are permit costs and there are surcharges with OSHPD. If you do anything, you're into substantial amounts of money. So it goes from maybe a couple million to a couple tens of millions. So it's just it's a good idea, and there's no question that the little precaution is always a fine thing. But at a time like this, when resources are declining, we're trying to focus our capital on maintaining patient care.
And that's my last question is focus. I mean, obviously with the state budget and with cuts, I've talked to people who are just trying to keep their doors open right now and having a very difficult time doing so. And, I guess I'll leave it on my own time. When facilities are having a tough time really keeping the doors open, and as the testimony here today, they haven't seen a real big problem. I guess the question's for the author. I'm very hesitant to vote for a bill that we haven't seen any problems, and at the time when we have the state budget, our grandparents are having a tough time, because what happens is if these facilities shut down because they can't keep their doors open, I'm just kind of wondering where the author's coming from when the problem's not there.
We haven't had any deaths in the state of California, and actually this bill is designed to prevent those. We have had, in skilled nursing facilities, we have seen deaths in the state in residences from carbon monoxide poisoning. There have also been other incidents short of death around the United States, and there was a recent death in a place called Humboldt, Canada, which is actually what got my attention, because I represent Humboldt County, which happens to be in the United States, not Canada. But
okay, you mentioned death center. You mentioned death center, but is there any evidence you have that anybody's been severely injured or injured at all?
There have been other incidents of injury. I cannot cite them right off the top of my head, but I'm happy to give them to your office.
I would like that.
Sure,
I mean, just because I see this as a bill that's obviously we want to prevent any of this from happening, and the intention's good, but
I understand.
when we're talking about the cost, and it's not.
But if I could address the cost,
Please,
for one thing,
please.
we did take amendments so that there should be no rewiring required. Battery-operated devices are allowed. They are purchasable at Home Depot. Now, whether or not that will respond to the regulations, I don't know, but you can go down to Home Depot. I think I spent $50 on mine, which is a carbon monoxide detector and a smoke detector device in one. And again, because these will be battery-operated, or can be, there shouldn't be any rewiring required. And they don't have to be placed out of every room. The amendments that we took require them to be placed near fossil fuel burning appliances. It is those appliances that are the ones that produce the carbon monoxide. So it's a very simple, low-cost safety device, and the costs of not installing them are actually much more, and the risks are much more than installing them.
Well, Senator, if you can pass on the information from
Happy
folks. Just today, I'm hesitant to move forward just because of where, again, I've talked to facilities that are barely keeping their doors open right now. Obviously, we have this budget that would deal with it. You know more than anybody, but I'm interested to get that information and hopefully work with you moving forward.
And most of these are private facilities, not state.
I understand, but private or state, even if you're a private facility, you know, many of them get Medi-Cal reimbursements rates, and they're getting less and less. And a lot of times the state's not very good about sending them the money. Many of them can't take loans up to the amounts that we're not paying them, so they can't stay open, and that's one of the biggest problems that we have.
Sure, and we'll get your office that information.
Okay, is there any other question for the members? Is there any comments? Okay, we have a motion by Senator Alquist. Let me just make also some comments before we call the roll. I understand where the opposition's concerns are coming from with regard to the facilities, because I've had an opportunity to visit some of the facilities as well in my district, and I understand what Senator Strickler's talking about with regard to the reduction of Medi-Cal reimbursement rates. So it does make it tough, especially when you have onerous mandatory issues with regard to like OSHPD. However, what we did do with this particular bill, we struck out some of the language that stated and allowed an entity to use a battery-operated device, therefore reducing the cost significantly. So at the end of the day, trying to be sensitive to the concerns of the opposition, but also realizing that in the event that somebody does have carbon monoxide poisoning, I have to outweigh what's ultimately in the best interest to the consumer and or the patient, and I'm still going to kind of always fall to the side of the consumer. So, we have worked with the author and trying to address some of the concerns. So at this point, I'm willing to support the bill and ask that the other members support it as well. So with that, we have a motion to pass as amended to appropriations. It was moved by Senator Wolk. Secretary, call the roll, please.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland. No. Strickland, no. Alquist. Alquist, aye. Anderson. Blakesley. Anderson, no. Blakesley. De Leon. DeSaulnier. Rubio. Wolk. Wolk, aye.
That has 3-2. We'll put the bill on call, Senator.
Thank you.
Okay, we're going to be going to item number 2, SB 42, Alquist, Medi-Cal contracts. Senator Alquist, good afternoon.
Good
How
afternoon.
are you? And welcome.
Good afternoon. Thank you, Mr. Chair. I would like to offer authors' amendments to address the concerns raised by the committee analysis. The sergeant is passing out a mock-up. Thank you for working with me on that and with my staff. These amendments would strike the existing language and require that if utilization in a dual eligible program, that is a program that provides services to patients eligible for both Medicare and Medi-Cal, differs substantially from the capitated rate, a plan reports this to the Department of Managed Healthcare and the legislature. This will allow the department and the state to manage its resources better in these fiscally stressed times. The problem, given the fiscal situation of the state and the cuts to senior services, it is important to ensure that the state pays only for services used. If the state has established capitation rates that do not reflect the level of services used, the faulty rate can take money away from other state services. These services include help to vulnerable Californians, such as nutrition, hearing aids, and dental care. When settling a capitation rate, DHCS may assume that 80% of patients will enter a nursing home, and then only 40% enter a nursing home, which is another expense. If this capitation rate differs substantially, for example, 10%, we can work on that as the bill hopefully evolves, from the actual use, this error could cost the state millions of dollars. When these errors occur for a number of years, the amount could be hundreds of millions of state dollars. This type of overpayment impacts the decisions made in Budget Sub 3 when deciding what services that the state can afford to provide. This money could be used to provide startup funds for a successor program to ADHC and many other services. So, what the bill does, as proposed to be amended, SB 42 would require a plan to report to the Department of Healthcare Services and to the legislature if the utilization differed substantially from the capitation rate that the plan received. If a plan currently reports this information, then it can simply forward a copy to the legislature. By providing this information, a plan would alert the department and the legislature to problems with rate setting. The notification that the actual use differs substantially from the anticipated use will allow a plan to notify the legislature if not only overpayment but also underpayment occurs in the capitation rate. You can see, Mr. Chair and members, why it's really important for this information as to the effective use of capitation rate is really communicated to us. And we know of situations where the state has overspent $100 million to $150 million when a higher capitation rate was used and a much, much lower utilization rate was actually provided. So that is what the bill does. I ask for your support.
Thank you. Does anyone like to speak in support of the measure? Is there any opposition to the measure?
Mr. Chair and members, Don Gilbert, representing 4 county organized health systems. We have concerns about the bill. We understand the objective. It's a good policy objective. We don't have any problem with that. We think we're inadvertently kind of caught up in this bill, so we've been working closely with the committee staff and the author's staff since the language came out very recently, and feel that we will get there. And so we did want to raise the fact that we are concerned. We do a lot of rigorous reporting right now. I think the kind of reporting that the author is looking for in this bill, we don't want to be tripping over multiple reporting that's kind of the same type that we're already doing. And so that's the basis of our concerns, but we are optimistic that we'll get to a solution. And again, we do understand that it's a good policy objective. Thank you.
Thank you. Next.
Catherine Reese, representing CenCal Health, which is also one of the county organized health system plans, and the oldest one. It's sort of the national granddaddy of this particular model. And so we certainly support Senator Alquist's quest and the purposes of her bill. Certainly no one should be overpaid inappropriately, and we understand that. Our concern is that our guys tend to be the good actors in all of this. We are very tightly regulated, very tightly monitored, great strictures about how our rates are developed. We have huge reporting requirements, and we're concerned that potentially an inadvertent consequence or an unintended consequence may be an overlay on us. We get captured in that we've now got some apples and oranges reporting that we must now comply with that are in addition to all the rate regulation kinds of governance that we are subjected to. So it would be our hope ultimately that the county organized health systems be amended out of the bill. We've certainly been working with Mr. Bain committee and certainly Senator Alquist's staff and have furnished them the statutes that govern us, and so hopefully we can get this resolved as the bill moves forward.
Thank you. Next.
Thank you, Mr. Chair and members. Nick Luizos with the California Association of Health Plans. We acknowledge that there have been very extensive discussions over this issue in the last few days, and we're appreciative of that. Our opposition is to the existing version of the bill. We're unable at this time to remove our opposition to the bill based on the amendments that are moving forward. We need more feedback from our members about how that language impacts contracts, existing reporting requirements, and capitated agreements with the state. But we'll be sure to communicate what our disposition will be on the bill moving forward. Thank you.
Thank you. Any questions from the members? Yes, Senator.
Senator, former Chair Alquist, I understand your concerns on this issue. Have you thought about maybe just holding an oversight hearing, maybe asking DHCS, and explain how this all happened instead of maybe going forward on this bill? I mean, obviously, I understand your concerns, but have you thought about maybe doing that?
Well, the reason this has been an issue going on for several years, actually. And the reason I finally decided that I needed to carry legislation is that I feel that we needed a law that actually said, if an entity is keeping many, thousands of dollars of state money because they were provided with a capitation rate which was way above what they actually utilize, that there needs to be a way. I mean, frankly, if every entity that received money just said, oh, I was overpaid by $100 million, I'm going to give that money back to the state because it doesn't belong to me, that is not what is happening. And so, we are willing to continue the discussion, but it seems to be, and if things change, I will do things differently, but it seems to be a case where because the state at times has provided a rate, 30-40% higher of what was actually used, and the entity did not return the dollars, there's got to be a way for the entity to say, you gave me too much money. And as proposed to be amended, the bill simply says that if utilization in a dual eligible program differs substantially from the capitated rate, the plan needs to report this to the Department of Managed Health Care and the legislature. That's all it says.
Okay, Senator, I want to thank you for bringing this issue forward. I know you've been working with Senator Lowenthal as well, and with this particular issue. So, any other questions from any of the members? Seeing none, do we have a motion to move the bill? Motion to move the bill. Senator Woke, this is due pass as amended to appropriations. Secretary, call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Strickland, no. Alquist?
Aye.
Alquist, aye. Anderson? Blakesley? De Leon? DeSaulnier? Rubio? Wolk? Wolk, aye.
That is 3-1. We'll put it on call and wait for the rest of the members to come.
And Mr. Chair, thank you for your help and the help of your consultants.
My pleasure.
Appreciate it.
My pleasure, Senator. Okay. And then me. We're at item number 5, SB 413, La Malfa disposition of human remains.
Good afternoon, Mr. Chairman and committee members. Thanks for having me. I'm presenting SB 413 today. This bill would allow family members to bury or cremate their loved ones if a county health department is, for staffing or budgetary reasons, unable to issue a permit for the disposition of human remains within a reasonable amount of time. Lorna Livingtree, a resident of Del Norte County, was unable to bury her father for nearly 2 weeks due to delays caused by furloughs, budget cuts, and state holidays. In working on the bill, I've informed the committee and the California Association of Public Cemeteries. I'm willing to accept the association's amendments, which require cemeteries to be provided with permit applications in instances in which permits failed to be issued. The association has indicated it will remove its opposition after these amendments are included. While they could not attend today, my staff has worked with them and met with their staff as recently as yesterday. I've also offered amendments to address some of the committee's concerns, which will allow health departments to withhold permits in instances where a death is caused by a contagious disease or suspicious circumstances are suspected. I'd like just to read an excerpt of the actual letter that the lady, Lorna Livingtree, sent us that was the impetus for the bill. I've excerpted it here so you don't have to hear the whole thing and some of the anger and frustration that came through with the process here. But her father had passed away, and so it fell upon her to make the funeral arrangements. She traveled to Sacramento to work with a funeral home that had helped with her mother before. To her great, it was a Tuesday, and she planned to have the funeral on Saturday so that her relatives could attend without missing work. To her great surprise, the funeral director explained she could not bury her father on Saturday because it takes 4 business days to get a permit from the state of California. She explained that Friday was a furlough day and Monday was a state holiday. So the soonest she could have a permit was the next Wednesday, and she could bury her father on Thursday, which was 10 days later. She was at first incredulous and then appalled that state red tape could cause such a delay at such a painful time for she and her family. She's asking us here today to right this wrong and remove the requirement that grieving families have to wait on a bureaucracy to bury their loved ones. She doesn't understand why such a requirement exists. Why does she need a permit to bury a dead body? She wasn't asking permission to bury him somewhere unusual, but in a cemetery, a plot that was already bought and paid for there. It wasn't under suspicious circumstances that he died. It was of a stroke in a hospital. It was not a contagious disease. Why did she need a permit to bury him? What is the point? The word permit implies the power to grant or deny a request. What if they didn't give her the permit? What is she supposed to do with that body? So she sat there on a Tuesday with a body she could not bury for 10 days. Now, she didn't know who the bureaucrat was, but that person was not going to come up from Sacramento or somewhere in California to look at the body or do anything physically about that. Now, so as far as she can tell, it wasn't really a permit, but is more of a statistical gathering exercise. So I could go on here, but you can see that there's a lot of pain and even outrage by folks that are going through this. And with me, I have a funeral director from Salas Brothers Funeral Home, just south of here, Jonathan Salas, who would like to offer his insights on what they deal with in that line of work.
Please proceed, sir.
Mr. Chair and members, my name is John Salas. I'm a licensed funeral director with the state of California and a third-generation funeral provider. My family's been in the funeral service industry for almost 90 years, and this is a very sincere issue that we deal with on a day-to-day basis. When I have to explain to a family, and while we're not the funeral home involved on this specific letter, I could, more time than this committee has, time and time again, relay the same story from family members when I have to tell them and have them actually sign a declaration that we instituted saying you may be longer than 10 business days until we actually are able to receive the permit for your family member. And when they turn around and blame us, that's a difficult thing, because why would we want to delay that process? So many of these families, of course, what have they gone through to this point? It's a wide gamut of the pain and suffering, and that's turned to us as if we're extending that pain and suffering even longer and delaying that grieving process to be allowed to get to a better place, hopefully. I don't know how many of you up there have been directly involved with family members or planning funeral services for family, and maybe within your own hearts and minds you have a specific idea of when and what would be reasonable for a time frame of arranging a funeral and everything that goes into it, great or small. But that is a very, very serious concern that we're dealing with, and I am certainly proponent of moving forward in a better direction, that we don't have to make families more angry with us, and definitely reflect back on the doctors, back on the medical facilities, and the local health departments, the local county health officers, and on and on. I mean, it's a much broader perspective than just saying a 3-week period of time. So I'd hope there would be some very serious consideration. Do you maybe have any questions for me? I'd be more than happy to discuss some of the particulars if possible.
So you're here in support of the measure?
I am.
Not here for technical reasons?
I'm here in support of the measure,
right, because
yes.
we didn't receive any letters of support, so that's why we're just kind of curious. So maybe you may want to either give your name to the sergeants later, and we'll put it for the public record. Also, before we proceed any further, we don't have any mock-up form of any kind of amendments. Can you kind of re-clarify what the opposition's amendments are and what you're willing to do or what you want to do, and kind of restate those?
Certainly.
For the record?
It's a fairly recent happening here. So we're working with the California Association of Public Cemeteries, that we're willing to accept their amendments to allay their concerns about the process here. So their amendments ask that we require cemeteries to be provided with permit applications in instances in which permits fail to be issued. So we can clarify that as see fit here. But it will not remove its opposition until after these amendments are included, of course. So Kevin, you got any?
So, yeah, do you have some more amendments? And then I think we have a question here, or more comments? Just that amendment?
Correct.
Okay.
But I'm willing to work with the committee on that, on other concerns as well.
Okay,
but,
Senator Strickland?
I was just going to point that out. So you are working with opposition on fixing whatever, problems they might have.
Right.
With your bill.
We have no real opposition other than the concern by the cemetery association there. So, and they're happy with where we're going with it.
And if I can ask, gentlemen, I forgot your last name. I know it's first name. Salas. Mr. Salas. Is it not true that when you're dealing with this kind of an issue, a couple points. Usually you're dealing with the county, right? The county coroner. And then the local
health department.
The health department. It's all local driven, isn't it?
Well, just recently, within the last, primarily the last 5 to 6 years, the state of California implemented what was called the EDRS system, Electronic Death Registry System. And before, we actually had to go out and physically track down all the doctors involved with signing the permit physically each day for every family.
Wow.
They had to physically sign the death certificate and causes. So if you can imagine in this day and age of us having to do that, my funeral home alone handles over 700, and I shouldn't say handles, I apologize, serves over 700 families every year. We have one facility, and I can speak.
So let me get this straight. You're dealing with the local level government in almost every capacity other than this permit from the state.
Correct.
And in many cases, they're not getting back, so people can't bury their loved ones.
Correct.
Now, what happens in terms of, look, for example, a Jewish religion, you have to bury within 24 hours.
Well, and that's ideally, yes, the 24-hour
Have you had
period.
to deal with people that's part of their religion?
We bury solely the specific entire Jewish community in San Luis County.
And what do you tell those families?
Every family, and this is family connections for generations, and I still answer those questions on a month-to-month basis with the rabbi and everybody else. Why are we put in such a position? They do not have their family members embalmed. They do not want or have specific religious freedom, basically, in a quote-unquote way to prevent the coroner from actually doing an autopsy, just to protect their religious belief. And yet they still are looking at 4, 5, 6, 7 days sometimes to allow their family member to be buried. But again, it's not one specific religion; it's across the board.
I understand that.
Certainly.
I just know that from experience of going to unfortunately funerals, that it's within 24 hours for the Jewish religion. And so, Senator LaMalfa, again, so yours is within 3 weeks? Well, what's the...
We would like to actually, in order to work with the committee, narrow this as we move along. I know the committee's had expressed concerns. I would like to see us eventually, as we move this along, become one where it's not a permit, but simply a report that is filed after the local government has handled the issue. Again, the coroner, the local health department can determine if there's a problem with a suspected death or a possible health issue, some part of an outbreak of a disease. They can figure this thing out in a very short term locally. Nobody from Sacramento or even the state goes over to travel to see this. All it is basically a piece of paper they're setting up saying, yes, you can do this, where the state is just tracking statistics. So where this bill really needs to go is that area.
Well, I hope you get to that point and after the fact, because I will tell you, if you don't fix that point, especially when it comes to someone's religion, I just couldn't even imagine, sir, being in your position and telling people they can't follow their faith because of state permitting law. Please, let's...
And again, that is, the difficult burden that we carry every day. And my direct answer back to these family members is why would we want to extend that? I don't want to. I mean, sometimes I think the perception out there is those of us that are in the funeral service field are somehow exempt. Our families are exempt from death. I mean, certainly not. And I know that I'm under the same auspices of those laws, and my pain is just as bad as anybody else's. And we do the best that we can to facilitate the wishes. And again, you all, as I asked a little bit earlier, you probably have in a mindset or have been involved with families' funerals. How long from the person's passing to when you had the service? Was that a reasonable time period or was it not? And it seems to be that it's getting more and more not reasonable. And again, if it was presented to, if it helps out, there is a state law currently that says the causes and really the whole permit and everything is to be completed within 15 hours of death. And not once have I ever seen that occur. Not once.
Okay, is there any other questions for the members? Do we have a motion? We have a motion by Senator Strickland. I'll just make a couple comments before we ask for the vote. I think this is a little far-reaching with regard to the permitting. I haven't sensed or haven't got any indication that there's any really big problem statewide. Permits could be delayed for legitimate public health reasons. So, for that reason, I'm gonna not support the bill at this time. But I'll ask.
May I ask, Mr. Chairman, with the process we have, with coroners in the local level health department, with known outbreaks of, if there's an outbreak of some type of disease or problem in a local area, it would be known, and a local government would be watching for this thing upon a death. Now, there isn't that in this case, and there isn't in most cases. You heard testimony from the gentleman from Salas Brothers here that, indeed, all this is a bureaucratic delay by the state of California. No service is being provided here other than them keeping track of statistics.
But do you think this is an isolated case, or do you really think this is endemic of what's going on statewide?
Mr. Salas could probably answer that.
I've already heard his testimony, and also for what you're asking for is if there's no response within a 3-week period, then it becomes in effect. But even a three-week period is a lot longer than a 10-day length of stay.
Only because we're working with the committee right now to try and have this day, have this moment of discussion here, and have the members of the committee hear beyond the bureaucracy of what this really means to families, what it means to people here.
So at this time, I'm not prepared to support the bill. If you would like to turn it into a 2-year bill to give us some more time to work with you, we'd be more than happy to do that. So that's one of your other option.
I would suggest you do that. It's hard for me to tell. I'm sorry.
Go ahead. So, we can either put up a vote, and you might get the votes, I don't know, but I'm not prepared to support it this time, or we can turn it into a two-year bill.
I guess...
Senator Wolk?
Yeah, it's hard for me to tell. Clearly what happened is not a good thing. Clearly. I've never had that problem in my 4 counties. Maybe there is a problem. I think I need to hear that this has more general general application than just this particular instance. I need to know. I need that kind of evidence to do this stuff.
Okay. We did hear it from one. I suppose I could...
We have someone here perhaps would like to make a comment.
Yeah, Mr. Chairman, Terry McHale from Aaron Reed and Associates, representing the California Funeral Directors Association. And we've taken a watch on this particular legislation. We were the ones responsible for the electronic death registration system to deal with trying to expedite, to make it quicker and to make it easier for this type of problem to be resolved. There has in the past, Senator Strickland, been discussion what to do in situations of religious problems. Obviously, our funeral directors are placed in a very difficult situation when it comes to Jewish and Muslim funerals and the need to bury as quickly as possible. But there has been effort to expedite this. I think the idea that we are seeing the problem more than it used to be because of furloughs in that situation. I think it'd be a good idea if we spent we would work with this committee and work with the author and spend the next couple of months to have this bill and more documentation and have it ready in January, which certainly would make sense to us. We are still watching ourselves. So we are very sympathetic to the situation with Senator LaMalfa. We're very sympathetic to anybody with 10 days. Obviously, in Salas Brothers, I'm from Modesto. I've actually been to a funeral at his facility. It was not mine, obviously, but it was it was well handled. We want to make it easier. I just think that we need more information. We applaud the author for stepping forward and bringing this, but why don't we spend some time together and see if we can go from a watch to a support.
Senator Strickland.
Terry, if I can I hope that you can come together with the senator, because I just couldn't imagine being in this gentleman's shoes telling, family members with something that's deeply involved in their religion that they can't bury their loved ones. That's extremely personal. And again, I guess I want to ask the question, why can't you go into, as the gentleman just testified, that he has to get doctors who are really busy, all these signatures before that permit is, and in most cases, it's the county that deals with it. What is the problem with doing it after the fact, after you bury them before, again, that permit? What's the downside of doing it after?
The downside is you get into this is you're going to have troubles with the lawful side, the legal side of it, because so many of these cases, they aren't sure if it's a homicide or if there's suspicious circumstances. There's that time.
If I can, if there's a homicide or if there's any suspicion whatsoever, I hear all the time about them bringing up a body to do DNA tests and different things. We're now having a technology where, there was a potential murder 20 years ago where they do that. Yeah, now, in those cases, can't they do that today?
Well, the problem with that, Senator, is, you take about, those situations that are 20 years old. 20 years ago, we were burying 80% of the people who died in the state of California. In this situation, we're cremating 50% now. And in the next couple of years, that trend's even going to go greater. We're cremating at a far more rapid pace than we ever have in the past, and it's a trend that won't end. I would just say on this particular situation that I agree with the chair that this is obviously a horrible situation, and nobody's more sympathetic to this than I am. I mean, it's not that I just hear from Salas Brothers. I hear from 700 different homes when something like this happens. In the particular instance of doctors having signatures, that took 3 years to get that bill going. I mean, there was opposition to electronic death registration system because people want to make sure that these things are handled properly. And there was that tradition at that time of a hands-on experience, that the doctor himself stopping what he was doing and focusing, because it also has cause of death. And so these are public documents that involve the end of life. They have insurance issues. They have public health issues. They have legal issues, all of these that can be complicated. And I'm not saying that the bill itself does not have value. Clearly, the discussion should be held. It was not my intention to come up and even discuss it today since we're watching it. But I think that we haven't, as Senator Wilk said, is it endemic? No, it's clearly not endemic. Is it reaching a point where it's problematic that we need legislative solution? Maybe. And maybe as we gather more information in another county separate from theirs, separate from Doug's or Senator LaMalfa's, there was an instance in which people complained that it was taking 5-6 days to get it. It turned out that there had been not only a furlough, but 2 people had left. They were bringing those in, and they were able to resolve it internally. So
before furloughs, you mentioned furloughs. Before furloughs, so how long has this been a problem for you, sir? Let me ask you that question.
Before furloughs.
I'm just asking, when did this problem first take place for you?
More specifically, over to a heightened level over the last several years. And it's certainly, I mean, I work with my staff directly every day and very, very closely on watching the filing of permits and their conversation with doctors, as well as a short pitching wedge shot down the street from the health department. I know all the health department officials keenly well, and so it is.
So this has been going on for
yes.
several years for you.
Yes.
Okay. Senator LaMalfa, if this bill does not move forward, it looks like it's not. I'm good at math myself, but Mr. McHale, I want to help fix this problem. I hope this bill gets out today, but if it doesn't, or if you withdraw, whatever, I just want to be part of this. And gentlemen, I'm looking forward to working with you because I couldn't imagine being in your position.
Okay, well, we have a motion on the floor to move the bill. If you wish, we can go ahead and go forward with a vote. If you choose to turn into a 2-year bill, then we'd have to ask the maker of the motion to withdraw the motion, if that's the wish of the author. So it's your choice, Senator LaMalfa.
Seeing the mood of the committee here, I will turn it into a 2-year bill, and hopefully we can resolve this. All respect meant seemed like a no-brainer for me because I don't see what product the state is giving here other than keeping track of paperwork and statistics. It's not doing anything to help out with an epidemic or what may possibly occur in one of these situations. And so we'll make it a 2-year bill, but I would just have people consider that in the process here, Osama bin Laden received a more respectful, better handling of his body by the military due to particular fears than what probably any Californians received in the World Trade Center in the amount of time it took for them to be brought back home and be run through this process here. So I would hope that this state could make the priority as respecting families and having a timely process here. So I do share the same frustrations as the person that brought us the bill, Lorna Livingtree of Klamath up in my district, that this is how it has to be. So we'll make this a 2-year bill and look to work with the committee and get this thing done so we're not doing this again. Thank you.
You will withdraw the motion. Okay. Thank you, Senator LaMalfa. We will turn this into a 2-year bill, and let me... okay. And then the remaining bills are my bills. I'll turn the gavel over to my vice chair.
Do you want to start out in order? Members, Chairman Hernandez's first bill that he'll bring up, it's file item number 4, SB 393. And Mr. Chairman, please open.
Mr. Chair, members, just give me a few seconds just to figure out which binder I've got to open up first. So we're going to do SB 393. Is that correct?
That's correct.
Okay.
That's correct. Thank you, Mr. Chair.
Mr. Chair, members, thank you. I'm pleased to present SB 393, which is sponsored by the American Academy of Pediatrics, the California Academy of Family Physicians, the California Academy of Physician Assistants, the California Association for Nurse Practitioners, California Primary Care Association, and the California Psychiatric Association. Members, Chair, this bill establishes the Patient-Centered Medical Home Act of 2011 to encourage licensed healthcare providers and patients to partner in a patient-centered medical home, a model of healthcare delivery in which a healthcare team, which is doctors, nurses, physician assistants, medical assistants, mental health providers, community health providers, health workers, and social workers, work in partnership with one another to coordinate care and ensure that patients receive the right care at the right time. Under PPACA, the Federal Health Care Reform Act, grants will be made available to states to establish community-based interdisciplinary teams to support medical homes and help primary care providers implement them in federal fiscal year 2011 and 2012. This bill ensures that a definition of the medical home is in place and will make it more likely that the states will receive the crucial federal dollars. There is no opposition to the bill, and I respectfully ask for your aye vote. And this is an integral part of health care reform, and I think it's very important. And with me, I have individuals that are here to testify in support of the measure. Mr. Chair and members.
Thank you, Mr. Chairman. Witnesses in support.
Mr. Chair and members, Tom Riley with the California Academy of Family Physicians, one of 8 co-sponsors of the bill. It's rare that the state has an opportunity to improve quality, reduce costs, draw down federal dollars for improving access to health care in the state without it costing the state any money. And that is what this bill would do. The hour is late, so we will not belabor our testimony. However, with me today is Dr. Karen Grossman, family physician here in Sacramento.
Doctor.
Thank you, Mr. Chair, Senators. It's an honor to be here. I'm here because the patient-centered medical home is the most exciting thing to happen in healthcare in my career. It's not a place. It's a set of best practices that allows a team to take care of patients and to create a plan and implement that plan in the way that works for patients. It's going to involve doctors, nurse practitioners, physician's assistants, as well as our pharmacists, social workers, nurses, and community health care workers to create this plan of care for patients. It's not just going to happen in my doctor's office. It's going to happen over the telephone, over email, in the ways that helps patients really get the care that they need. You know, in other states where they've implemented programs such as this, not only has care improved, but a lot of money has been saved. In North Carolina, in the first 6 years of their program, they've saved nearly $1 billion with a B. So the reason why this definition bill is important for the family physicians are 3 reasons. First, for the doctors converting their practices right now, it shows that the state values and acknowledges the efforts these doctors are making. Second, it protects these practices from somebody else calling themselves a medical home without actually doing the work. And third, it allows us to draw down federal dollars. In summary, for me as a family physician, it's important for me to have this medical home because it is the best opportunity for creating and implementing health for my patients. Thank you.
Witnesses in support.
Chair and members, Lori Johnson with the California Primary Care Association, representing over 800 private nonprofit community clinics and health centers statewide. We are the proud sponsors and urge your support.
Witnesses in support.
Mr. Chair and members, Bryce Doherty on behalf of the California Academy of Physician Assistants. We are strong supporters of the bill, have been for many years. Believe it will provide optimum coordinated medical care, and I want to thank the author for picking up the baton and running with it this year. I see Senator Elquist over there, a lot of grinning and nodding. I want to thank you for taking the lead on this issue last year, and also Insurance Commissioner and former Assembly member and Chair of the Assembly Health Committee, Dave Jones, who's also broke bread on this issue a couple of years ago. So thank you.
Witnesses in support.
Shannon Smith Crowley, American Congress of Obstetricians and Gynecologists in support.
Witness support.
Randall Hager for the California Psychiatric Association. We're co-sponsors.
Thank you. Witness support.
Carolyn Jenna with the California Medical Association. We support the bill because we believe that these are an excellent tool to provide, as prior testimony said, more cost-effective, better quality patient care. And as the bill moves forward, we'd like to work with the author and other sponsors and supporters to actually broaden its impact beyond the language today. Thank you.
Thank you. Witnesses support.
Christy Weiss on behalf of the California Association for Nurse Practitioners. One of the co-sponsors of the bill, and just delighted to be here, part of this Coalition Love Fest, and our thanks to the family physicians and Senator Hernandez.
Witnesses in support.
Good afternoon. Brianna Lehrman-Hinsey on behalf of Local Health Plans of California, an association representing local nonprofit community-based health plans. We are very pleased to support this legislation and thank the author for his efforts.
Thank you. Witnesses support.
Tricia Hunter, American Nurses Association, California, in support of the bill.
Witnesses support.
Brianna Pittman, Planned Parenthood Associates of Affiliates of California, also in support.
Thanks for being here. Witnesses support.
Tressa Wallace with Shaw Yoder Antwi on behalf of the California Mental Health Directors Association in support.
Thank you.
Mossberg, California Family Health Council in support.
Thank you.
Robert Harris on behalf of the California Society of Addiction Medicine in support.
Thank you for being here.
Philip Swanger here on behalf of the California Society of Health System Pharmacists, also in support.
Thank you. Now that we had all the witnesses...
And, Mr. Chairman, excuse me, Bill Barcelona had to run and catch a flight. He deputized me on the way out on behalf of the California Association of Physician Groups support.
Thank you. Okay, we had a long list of witnesses support. Witnesses opposition? None? Okay. Questions? Senator Anderson.
Senator, there are two issues that I had with this. One is, in the language of the bill, is there any language in it, whether it's under intent or otherwise, that would address any kind of capping the cost as we move forward? I know that there have been previous bills similar to this. I think the Jones bill had language that put some limits or put some intention of limits on the costs.
I don't know if that's germane to this piece of legislation, because what we're dealing with here is how we treat and care for the patient and how to get best practice and best outcomes. Perhaps maybe the sponsors can maybe address that, but I don't see that being germane to the conversation here.
Thank you.
Through the chair, I think the language that you are referring to is language that is in actually a number of the 43 states that have addressed this issue in state law. They want to make sure that if practices are investing the money, it is a lengthy, time-consuming process to become whatever model of medical home you want to become. They want to make sure that in the medical marketplace there is some way in which they are being, down the line as this grows, that they can be paid for that investment in higher quality, better outcomes, and so on. What this bill does in intent language, and I think the language you are referring to, simply says it's our intent that somewhere down the line that is seen as a value in the marketplace. It does not direct the state. It does not direct payers. It simply recognizes it as a value.
The reason why I asked that, and the reason why I thought it was germane, is right now there's nothing stopping you from doing this. Is that correct? All we're doing is codifying a practice that's starting to grow. Is that correct?
Not only is there nothing stopping practices from doing this, but many are doing this now. I think their fear is that after this huge investment, that they will turn around and down the street discover that someone has hung out a shingle saying, I am a patient-centered medical home, having made no such investment.
Okay.
But let me also just kind of clarify some of your concerns and reiterate what we just mentioned with regard to the medical home model and best practices. But also what's important is by codifying it and having it in state statute allows the state of California and the providers to go after federal dollars as well, which would be inhibited if you didn't have anything in state statute.
Thanks. I'll give it right back. Thank you very much.
Senator Ockles.
Thank you. I think this is one of the most important health care bills really of all time, because it's a major shift to really saying care for patients ought to be centered and be patient-centered care. Sounds very simplistic, but it's not really the way things work in the United States today. So I'm very supportive. Two other things I would love to be added as a principal co-author, since I care very much about this topic, and I'm 66, and certainly before I'm a little old lady, I want to see that this really is implemented, at least throughout California, way before I am quite older. And last, I would like to move the bill.
Thank you, Senator Alquist. Senator Wolk.
Just a brief comment. I represent Yolo and Solano among the other counties, and both of them are involved with Partnership Health, which is the Medi-Cal managed care provider, a COS basically, and it has implemented this model, and in fact, you get better care at a more reasonable price. So I think it's really the way that we should be going, and I hope that's in fact what happens nationally and here in California. So good for you. I'd like to be a co-author.
So the bill's been moved by Senator Alquist. Would you like to close, Mr. Chairman?
I respectfully ask for your aye vote, Mr. Chair and members.
Secretary, please call the roll.
The motion is due pass to rules. Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Alquist? Aye. Alquist, aye. Anderson? Aye. Anderson, aye. Blakesley? De Leon? DeSaulnier? Rubio? Wolk? Aye. Wolk, aye.
I'm sorry. That bill has 5 votes. Will remain on call. Mr. Chairman, file item number 6, SB 485.
Thank you, Mr. Chair and members. First of all, let me thank the committee staff for their hard work on this bill. They always do a great job. This bill has 2 goals. Number 1, to address the overcrowding of emergency departments by non-emergent cases, and to find a medical home for those who do not have access to regular preventative health care and or health care providers. In the healthcare industry, it has become an accepted fact that Americans seek a large amount of non-emergency care at hospitals' emergency rooms. The reason for this are varied, but the lack of difficulty accessing primary and specialty care in certain underserved communities, namely low-income and urban and rural communities, seem to be a crucial factor. An additional factor adding to the stress of the healthcare safety net is the recession, during which many families have lost their healthcare coverage. So this bill would set up a pilot program between a hospital and a clinic to assist in finding those who utilize the emergency room for non-emergency care and to find them a permanent medical home. It would work this way. When a patient is treated in an emergency room and require follow-up care, upon discharge, the hospital personnel would set up a follow-up appointment for their patient, for their partner clinic. The hospital would then give the patient, as part of their discharge package, written information about the appointment, where the clinic is, how to go to it, and where will they see it. So bottom line is, unfortunately, because fewer and fewer individuals have access to health care, have health insurance, end up in the emergency room for sometimes when it's too late, but more cases than not, they're there because they're just there for primary care. As we all know, in the emergency room, it's overcrowded, it's much more costlier, and especially to the states with regard to Medi-Cal, if you're seeing primary care patients in an emergency setting, it increases the cost. This was an idea that I came up with just to make sure to see how we can reduce overall health care costs, and just by putting together this pilot program, to see that if we can get individuals who come into an emergency room who have primary care needs that are an emergency, that we can find a medical home model for them, look at and see how we can reduce overall health care costs. And with that, I respectfully ask for your aye vote, Mr. Chair and members.
Thank you, Mr. Chair. Witnesses support.
Chairman and members, Barbara Glazer with the California Hospital Association. We are in support of the bill. We estimate that approximately 1/3 of the patients in the emergency rooms don't really need to go to the ERs, and so we think this pilot will help us figure out how we can reduce those visits.
Thank you. Witnesses in opposition? Questions from the members? This bill has been moved by Senator Wolk. I just have one quick question, Mr. Chairman. Can't the department do this already without the pilot project? What's necessary for this pilot project within the bill if the department already has that ability?
I'm not sure if the department can do that, but I don't know and I know there's been instances, especially in San Diego, where they've done it. They've showed they've actually reduced some health care costs, but maybe we can get.
It's my understanding the department can if they so desire. Is that inaccurate?
I'm not sure. I think that unless the department's directed to do it, I just don't know that they'll focus on it and actually do it.
Okay, thank you.
I'm not sure.
The bill's been moved by Senator Wolk. Secretary, I'm sorry. Senator Anderson.
Senator, I like the bill. it has a mandate. If it was an authorization, I could get there because I'm not sure that there's a. I'm not sure we couldn't get there with an authorization as opposed to a mandate. As we're moving forward, I'm not going to be voting with you, but I don't think that you need my vote to pass it out of committee. But I don't want you to think that I'm just voting against it. That's the distinction, though, on this bill, because I'd like to be there. I'd like to be more supportive of it.
But it's a pilot project. We're just doing it in a small area. That's fine. I understand.
Thank you.
Secretary, please call the roll.
The motion is due pass to appropriations. Senator Hernandez?
Aye.
Hernandez, aye. Strickland? No. Strickland, no. Alquist? Aye. Alquist, aye. Anderson? Anderson, no. Blakesley? DeLeon? DeSaulnier? Rubio? Aye. Rubio, aye. Wolk? Aye. Wolk? Aye. Wolk, aye.
That bill has 4 votes, 4, 2 against, remain on call. Mr. Chairman, members, last bill, file item number 9, SB 690.
Thank you, Mr. Chair and members. This bill simply implements the new federal health care reform law by prohibiting a health care service plan, contract, or health insurance policy from discriminating against any class of health care provider who is acting within the scope of the provider's license. Discrimination by plans and insurers against whole classes of qualified licensed healthcare professionals impairs patients' access to care, limits consumer choice, and may result in increased healthcare costs due to lack of competition. This bill does not impose any willing provider requirement on plans or insurers, or prevents plans or insurers from establishing varying reimbursement rates based on performance and quality measures. We are pleased to accept the amendments recommended by the California Association of Health Plans that would better conform the bill to federal law and address the issues raised in the analysis. With 2014 approaching, we need to figure out a way to better utilize our existing infrastructure to ensure Californians have greater access to care. This bill moves us closer to the goal, and I respectfully ask for your aye vote, Mr. Chair and members.
Thank you. Witnesses in support.
Thank you, Mr. Chairman. Cliff Burke here on behalf of the California Optometric Association.
Cliff, yeah, can you hit the...
Better?
Thank you.
Thank you. Start again. Cliff Berg here on behalf of the California Optometric Association. We are pleased to sponsor this bill. We think it's important for all providers to be utilized to the fully extent to their scope of practice. Many of you over the years have been supporters of expansions of scope of practice. Obviously, it's difficult to practice if you don't get reimbursed. Many of the plans often don't keep up with the laws, and therefore the contracts with providers don't reflect what they're allowed to do. It would be a difficult situation for California consumers, for example, if they're being treated by an optometrist for vision services. They can treat conjunctivitis, but the plan doesn't reimburse the optometrist for that. So that what's the optometrist supposed to do? Send them back, tell them to schedule an appointment with an MD or an ophthalmologist 3 weeks later while they have a disease. I think this bill is essential fairness. It's common sense. It actually represents the best interests of the plans, and we would urge your support. It also simply conforms California law to federal law. This is already passed at the federal level.
Thank you. Other witnesses in support?
Terry McHale with Aaron Reed and Associates, echoing Cliff, and also to say that we support as the amendments have been proposed.
Thank you. Witness support.
Angela Blanchard on behalf of the California Association of Nurse Anesthetists, as well as the California Nurse Midwives Association, in support.
Thank you.
Yeah. Mr. Chair and members, Monica Miller on behalf of the California Chiropractic Association, also in support. Thank you.
Thank you. Witness support.
Judy Wola with California Naturopathic Doctors Association, in support.
Thank you.
Tricia Hunter with American Nurses Association, California, in support.
Thank you.
Tim Shannon, representing 2 clients, California Association of Marriage and Family Therapists and Hearing Healthcare Providers of California, in support. Thank you.
Thank you. Witnesses in opposition.
Mr. Chair and members, Nick Luizos, California Association of Health Plans. Based on the amendments that are under consideration, we believe that removes our opposition to the bill. It's certainly reflective of the oppose unless amended letter that we sent on the bill. Of course, if any issues arise, we'll certainly let the author and the committee know if that happens. Thank you.
Thank you. Any other witness opposition? Willingness of the committee? Bill's been moved by Senator Alquist. Mr. Chairman, would you like to close?
I respectfully ask for your aye vote, Mr. Chair and members.
Secretary, please call the roll.
The motion is due pass as amended to appropriations. Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Ahlquist? Aye. Ahlquist, aye. Anderson? Anderson, aye. Blakesley? Aye. Blakesley, aye. DeLeon? DeSaulnier? Rubio?
Aye.
Rubio, aye. Wolk?
Aye.
Wolk, aye.
The bill's out. Or actually remains on call. Mr. Chairman.
Sergeant, can we call the absent members? Did Okay, I think the only member we have absent is Senator Wolk. We'll go ahead and finish and try to see if we can close everything up. We're going to start with item number 1. We never had a motion because we didn't have a quorum. Can I have a motion for we have a motion, Senator, who moved it? Strickland, SB 20. We have a motion, due pass to appropriations. Secretary, call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Ahlquist?
Aye.
Ahlquist, aye. Anderson?
No.
Anderson, no. Blakesley?
Aye.
Blakesley, aye. DeLeon?
Aye.
DeLeon, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Rubio?
Aye.
Rubio, aye. Wolk? So that's 7-1.
That vote is 7-1. The motion passes. I will still put the bill on call. Do we know if Senator Wolk's coming back? Does she want to add on, or? You know, we'll leave this one on call, and I'll stay just a little longer till I hear from Senator Wolk. Okay, the next bill is SB 42, item number 2. The current vote count is 3-1. It's due pass as amended to appropriations. Call the absent members.
Senator Anderson?
I'm sorry. Say it again.
It's item number 2, SB 42.
Thank you. No.
Anderson, no. Blakesley?
No.
Blakesley, no. DeLeon?
Yes.
DeLeon, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Rubio?
Aye.
Rubio, aye.
That vote is 6-3. The motion passes. We'll put that bill back on call. I understand Senator Wolk is on her way back, and we'll let her add on at a later time. We have item number 3, SB 136. We need someone to make a motion, please. We have a motion by Senator DeSaulnier. It's due pass to appropriations. Call the members, please.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland.
No.
Strickland, no. Alquist. Alquist, aye. Anderson.
No.
Anderson, no. Blakesley. DeLeon.
Aye.
DeLeon, aye. DeSaulnier.
Aye.
DeSaulnier, aye. Rubio. Rubio, aye. Wolf.
That vote has 5. The measure passes. We'll put the bill on call to allow Senator Wolk to add on. We're on item number 4, SB 393. The current vote count is 5-0. It's due pass to rules. Call the absent members.
Senator Blakesley. Blakesley, aye. DeLeon.
Aye.
DeLeon, aye. DeSaulnier.
Aye.
DeSaulnier, aye. Rubio. Rubio, aye.
That's 9-0. The measure is out, and all the members are present. We have We have item number 6, SB 485. We have due pass to appropriations. The current vote count is 4-2. Call the absent members.
Senator Blakesley.
Aye.
Blakesley, aye. DeLeon.
Aye.
DeLeon, aye. DeSaulnier.
Aye.
DeSaulnier, aye.
That's voted count is 7-2. Everyone's present. That bill is out. Okay. The next bill is item number 7, SB 594. Wolk, we need a motion, please. Motion to move the bill, Senator DeLeon. It is due pass as amended to appropriations. Call the members, please.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland.
No.
Strickland, no. Alquist. Aye. Alquist, aye. Anderson.
No.
Anderson, no. Blakesley.
No.
Blakesley, no. DeLeon.
Aye.
DeLeon, aye. DeSaulnier.
Aye.
DeSaulnier, aye. Rubio. Rubio, aye. Wolk.
Aye.
Wolk, aye.
That vote is 6-3. All members are present. That vote is out. That bill is out. We're on item number 9, SB. Item number 8. I'm sorry, SB 615. Due pass as amended to appropriation. The current vote count is 5-0. Call the absent members.
Senator Strickland.
Aye.
Strickland, aye. Blakesley.
Aye.
Blakesley, aye. DeLeon.
Aye.
DeLeon, aye. Rubio. Rubio, aye.
That vote is 9-0. All members are present. That bill is out. File item number 9, SB 690, Hernandez. It's due pass as amended to appropriations. The current vote count is 7-0. Call the absent members.
Senator DeLeon.
Aye.
DeLeon, aye. DeSaulnier.
Aye.
DeSaulnier, aye.
That vote is 9-0. All members are present. That bill is out. Item number 10, SB 751, Gaines. It's due pass as amended to the floor. Call the absent members. The current vote count is 6-0. Call the absent members.
Senator Alquist. Aye. Alquist, aye. Blakesley.
Aye.
Blakesley, aye. Rubio. Rubio, aye.
That vote count is 9-0. All members are present. That bill is out. Item number 12, SB 810, Leno, due pass as amended to appropriations. Current vote count is 4-0. Call the absent members.
Senator Strickland.
No.
Strickland, no. Anderson.
No.
Anderson, no. Blakesley. Blakesley, no. DeLeon.
Aye.
DeLeon, aye. Rubio.
That vote count is 5-3. All the members are present. That bill is out. Item number 13, SB 840, Evans. The current vote count is 3-2. Due pass is amended to appropriations. Call the absent members.
Senator Blakesley.
No.
Blakesley, no. DeLeon.
Aye.
DeLeon, aye. DeSaulnier.
Aye.
DeSaulnier, aye. Rubio.
That vote count is 5-3. All the members are present. That bill is out. The last two are consent. We have a consent item called, the current vote count is 4-0. Call the absent members.
Senator Strickland.
Aye.
Strickland, I. Anderson? Anderson, I. Blakesley? Blakesley, I. DeLeon? DeLeon, I. Rubio? Rubio, I.
Both those two consent items are out. The vote 9-0. We're going to lift the call for the absent members. We're going to start at the top of file.
We can change it once we've announced.
Okay, we're going to start with, we're going to lift the call for item number 1, call the absent member.
Senator Wolk?
SB 20.
Wolk, I. 8 to 1.
That vote count is 8-1. That bill is out. We're now on item number 2, SB. Okay, the vote count, item number 2, Wolk was yes, aye, so vote count is 6-3. That bill is out. And item number 3, SB 136, Yee, call the absent member.
Senator Wolk? Aye. Wolk, aye. 6 to 2.
That vote count is 6-2. All members were present, and that vote is out. That concludes the business of the day. The meeting is adjourned.